So one final part of the brain is the electricity portion. So our whole body works on electricity. That's one of the missing things in medicine. We look at the body as a bunch of chemicals, but we forget about the electrical nature of the body. So the reason my hand is doing this is my brain is creating electrical signals. It's going down my spinal cord and to my fingers. If suddenly there was a short circuit in my brain, instead of the nice controlled movement, there would be a sudden movement. That's a seizure. It's basically a short circuit in the brain. Now, if it's a small short circuit, we call that a petite mal seizure. And you get minor symptoms. It can be just fluttering of the eyes, random picking of the clothes, right, kind of staring into space. The good news is they don't pass out. They're only dangerous if they're walking when it happens, because they can keep walking right out in the middle of the street. All right, come on, there we go, here we go, there you go. Yeah, but you don't have to worry about them passing out. The more serious type of seizure is what we call a grand mal seizure, which is a large electrical short circuit, I should say, of the brain. Every time the brain short circuits, you get the movement. They call it tonic-clonic movement. Right? So every time you see that, that's the brain short circuiting. Boom, short circuiting, short circuiting. Is this really a big deal? You probably do this on purpose at the gym, assuming you can ever get to a gym, right? Yeah, it's not a big deal. The big deal is right before they have the seizure, they pass out. Now, a lot of seizure patients will get an aura of some sort. They hear a sound, they'll see a color, get a taste in their mouth as an early warning they're about to have a seizure. So if they're holding a knife, they know to put it down and actually get down on the ground. But sometimes they don't pay attention to it, or they don't get the aura, and they pass out and fall like a tree. That's where they get hurt. Now, as we talked about earlier, if you witness this and you see them hit their head on the table on the way down, snap, we have to be concerned about neck injuries. And it's going to be tough because there's a lot of movement. You're not going to be able to, and you don't want to try and restrain them. But we want to take that into consideration, especially when the seizure ends, to have somebody just hold their head still until paramedics arrive. The other thing about a seizure is that we don't use a bite stick anymore. We used to. In fact, the big concern was that they would bite their tongue. Well, it turns out the tongue is one of the fastest healing parts of the body. It's not a big deal if they bite their tongue. The big deal is this strong muscle. Remember, we talked about this. It's one of the strongest muscles in your body. That's why it's so tough to open up the airway sometimes. And so people jamming stuff into the patient's mouth, they would break teeth. They could actually break their jaw. And rescuers were getting their fingers bitten off, literally amputated. Yeah, no thank you. So nothing in the mouth. And yet, you're at a restaurant, what do people want to do? Quick, jam something in his mouth. What do you say? Hey, I'm medically trained. I can take care of it. We don't do that anymore, but thank you so much for stopping. Now, the seizure generally lasts 30, 40 seconds, but it's going to seem like eternity. And again, their big problem after the seizure is they're going to be unconscious. So what do? That's right, ABCs. Do we know why they had the seizure? No. They could have epilepsy, or they could have had a head injury and that caused the seizure. Or they might, all right, So once the seizure stops, they're going to be unconscious. So once the seizure stops, they're going to be unconscious. So what do? That's right, ABCs. Airway, breathing, circulation. Open their airway, check to see if they're breathing. If they're not breathing, start CPR. But most likely they will be breathing. So a lot of things can cause seizures. Of course, epilepsy can be a cause of seizures, head injury, prescription drugs have interactions or side effects that cause seizures. So a lot of things can cause seizures. The other thing that can cause a seizure is the heart stopping. See, if the heart suddenly stops, the person just drops. If the heart slows down and stops, they often have a seizure. We call it a hypoxic seizure, means not enough oxygen or without oxygen seizure. A lot of calls that come in to us that are cardiac arrest when we get there come in as a seizure. That's why I don't make any assumptions. Always check the ABCs, because that's what you'll find. If you do the ABCs, if they're in cardiac arrest, will they be breathing? No. Beautiful. And then you can just start CPR. Now, the other interesting thing that happens as the heart is slowing down before it stops is they often do what we call agonal respirations. Have you ever heard that before? No, it got your attention. Isn't that beautiful? They're literally starting to die, and they're basically talking to us, telling us, hey, I'm making this sound because in about 15 seconds or so, my heart's going to stop. I actually had that at the Rose Bowl. I was working on this guy who was unconscious, but he was breathing, and he started that agonal respiration. And I looked at my partner and I go, oh, here we go. So I had one hand here, one hand on his chest, ready to go. And sure enough, in about 15 seconds, his heart stopped and instantly started CPR. So there was no delay between his heart stopping beating and me beating it for him. That was a great save. That was a wonderful save. Beautiful. So seizures can be very disturbing, but just remember, it's always the ABCs.